Hi, I'm Dr. Daniel Bearzens, and I'm a physician here at Protea. And today I want to talk to you about how we do weight loss differently at Protea. Now, most people, their standard for if they're losing weight, is it working well or not, is the number on the scale. And one of the first things that you'd find out as you become a patient here that you become very familiar with is something called an in-body scale. Now, in-body is something maybe you've seen at your gym. It uses something called bioelectrical impedance. And this is looking at other components than just the number on the scale, which can be very deceptive. So one of the things that makes an in-body really special is it's going to look at a couple different factors such as skeletal muscle mass, dry lean mass. So when we take water out of the equation, how much beef jerky do we have? Total body fat mass. So how much body fat are we carrying relative to the rest of our body? And then it'll even estimate something called visceral fat. Now, from a health perspective, visceral fat, which means the fat that adheres onto our organs like the liver, the pericardium, the pancreas, the kidneys, that is the burdensome fat. That is the fat where maybe you've been told you've had fatty liver, we get some accumulation. It is quite inflammatory. Interleukin-6, which is one of the big markers that our visceral fat will push, leads that inflammation process in our body. Our subcutaneous fat, or the fat that we can feel, while it's not aesthetically pleasing to us, it's not near as detrimental to our health like visceral fat. And that in-body is actually going to check out what's going on with visceral fat. Now, in each of your patient visits here at Protea, we usually get a baseline for your in-body when you first come in, and each subsequent time, we're basically going to be able to plot over time changes. Now, some patients, when we're doing weight loss, they'll come in after a couple of visits, and they're just looking at the number on the scale, and they're like, it's not working. And maybe this is you, where you've been really trying with some changes in your diet, you've been starting to exercise, but you're not seeing the number on the scale move. But that number isn't telling you everything going on. And this is a common thing that I'll see when I walk in with a patient and they're frustrated that the number on the scale hasn't moved. But when we look at their other more detailed items like skeletal muscle mass increasing and body fat mass decreasing, I share with them, this is exactly what we want to see. One of the big things that we focus on here from a weight loss perspective isn't just losing weight to lose weight. Can we lose weight where we want to in just body fat mass? And can we increase, if not maintain, skeletal muscle mass? Because where that comes in and why we do things a little bit different as a muscle preservation technique is our muscle is the sustenance. Our muscle helps keep us in an insulin sensitive state versus when we lose muscle, we can be more susceptible to things like insulin resistance. If you're not familiar with insulin resistance, I recommend you check out one of the other videos on our feed that'll talk more about that. Muscle is the sustenance for not only helping to lose the weight, but keep the weight off. Now, the more muscle that we have, the more our basal metabolic rate increases. This is something that I'll talk to patients about, that when we're building muscle, you just being alive and breathing on its own, you're burning more. So it's not just the endless hours of cardio that's really going to make all the difference in your weight loss efforts. It's how is the muscle health? And certainly cardio is going to play a role in that, but this is where things like even resistance training come into play and a higher protein diet. Now, typical protein metrics can be really off in a standard American diet, and aim for even upwards of about 1 gram per pound of ideal body mass can make a huge difference from a protein synthesis standpoint, satiety standpoint, and really helping to drive and shift that metabolism out of an insulin-resistant state. All of these things we can track with something like an in-body. Helping with reducing that visceral fat isn't something that we can really just spot reduce, right? It's a net result of reducing body fat mass overall, and we can watch that number by itself with something like an in-body. Now, BMI and just the number on the scale are two things I'll tell patients right out the gate. They are not my indicator for is this working or not. And I would encourage you not to let just the number on the scale be your guide for if you're doing the right things. Percent body fat is much more of a metric that I can infer to for is this working in the right way? Because like I mentioned before, you can maintain the same number on a scale, but as our body composition changes, muscle weighs more than fat, we might stay the same on the number, but our body fat has dropped dramatically. And that is normally seen when we have an increase in skeletal muscle mass and a drop in body fat mass overall. And it's appropriate to work with the physician for what might be a healthy range for a percent body fat for you, because those are going to differ based on your gender, your age, because we do need a little bit of body fat on us to stay alive. But where we want to see is reducing those more problematic things to your health, like that visceral fat. If you choose to establish here at Protea, you'll become very familiar with the in-body process, and most patients actually learn to really enjoy that. You'll get a printed copy of your results, and you'll even get a link where you can download an app and track these results on your phone, kind of like in a plot graph. One of the really cool things that we just got to look back on here at Protea was what are the tangibles? What was the true success that we've been having in our weight loss efforts here at Protea? In the year 2023 alone, between all of our patients combined here at Protea, we had a net loss in over 4,600 pounds of pure body fat mass. Now that amounted to a net drop in total weight of over 5,000 pounds here at Protea. Now, we've had some patients who have lost over 100 pounds, and we've had other patients who didn't necessarily need to lose as much. Nonetheless, we are seeing success. It is very important that you work with a provider who's not just going to tell you to eat less and exercise more, that they might be looking at some things that are often overlooked when it comes to difficulty in weight loss efforts. And like I mentioned, insulin resistance, hypothyroidism, low androgen levels in men and women, as testosterone is going to drive our metabolic rate, our ability to make lean muscle mass. All of these things are things that we take a look at here at Protea, alongside an amazing team of nutritionists who really help get down into the weeds with our patients, tailoring their goals, providing our patients with individualized nutrition plans, working alongside the goals that their physician has for them. And this is one of the huge benefits that we offer here at Protea. Outside all of our amazing physicians is our amazing nutrition team. Even if you're interested in just seeking an appointment with our nutritionist, we would love to have you. Take a look at the link below for some information where you can call and get scheduled. And if you're looking to establish with a new physician and maybe your weight loss efforts have been difficult, I would highly encourage you to work with a provider who's willing to get down into the weeds, give an individualized plan to you, and do not settle for you just need to eat less and exercise more. There's so much more to weight loss than that. We look forward to seeing you here at Protea. Thanks for your time. We'll see you on the next episode.